Today I will talk about skeletal system. Skeletal system. The skeleton consists of cartilage and bone. Cartilage has a role in growth and repair of bone, and in the adults forms the articular skeleton responsible for movement of joints. Bone is a specialized form of connective tissue which performs the function of providing mechanical support and is also a mineral reservoir for calcium homeostasis. There are 206 bones in the human body, and depending upon their size and shape may be long, flat, tubular. Normal structure of bone. Bone is divided into two components. 1. Cortical or compact bone. Comprises 80% of the skeleton, and is the dense outer shell responsible for structural rigidity. It consists of haversian canals with blood vessels surrounded by concentric layers of mineralized, collagen-forming osteons, which are joined together by cement lines. 2. Trabecular or cancellous bone. Composes 20% of the skeleton and has trabeculae traversing the marrow space. Its main role is in mineral homeostasis. Histology. Bone consists of large quantities of extracellular osteoid matrix which is loaded with calcium hydroxyapatite, and relatively small number of bone cells which are of three main types: osteoblasts, osteocytes and osteoclasts. 1. Osteoblasts are uninucleate cells found abundantly along the new bone-forming surfaces. They synthesize bone matrix. The serum levels of bone-related alkaline phosphatase, other being hepatic alkaline phosphatase, is a marker for osteoblastic activity. Its levels are raised at puberty during period of active bone growth and in pathologic conditions associated with high osteoblastic activity such as in fracture repair and Paget's disease of the bone. 2. Osteocytes are those osteoblasts which get incorporated into the bone matrix during its synthesis. Osteocytes are found within small spaces called lacunae lying in the bone matrix. The distribution of the osteocytic lacunae is a reliable parameter for distinguishing between woven and lamellar bone. Woven bone is immature and is rapidly deposited. It contains large number of closely packed osteocytes, and consists of irregular interlacing pattern of collagen fiber bundles in bone matrix. Lamellar bone differs from woven bone in having smaller and less numerous osteocytes and fine and parallel or lamellar sheets of collagen fibers. 3. Osteoclasts are large multinucleate cells of mononuclear macrophage origin and are responsible for bone resorption. Osteoclasts are found along the endosteal surface of the cortical bone and the trabeculae of trabecular bone. 4. Osteoid matrix. The osteoid matrix of bone consists of 90 to 95% of collagen type I and comprises nearly half of total body's collagen. The architecture of bone collagen reflects the rate of its synthesis and may be woven or lamellar.